Hi, my name is Shuai Zhen from the University of Technology, Sydney. In this presentation, I hope to introduce you to our study design for a randomized controlled trial to investigate the effect of 12 weeks of Tai Chi practice on anxiety in healthy but stressed people, compared to exercise and weightless comparison groups. Our hypothesis is that Tai Chi is statistically non-inferior to exercise in moderating stress, and that Tai Chi is statistically superior to doing nothing in moderating stress. The inclusion and exclusion criteria are as follows. Participants for the study need to be between 18 and 60 years of age, have no serious medical conditions as screened using the lifestyle appraisal questionnaire, be English literate, and also score above the threshold of 50 on the state trait anxiety inventory. The exclusion criteria are that participants should not be suffering from a serious illness, taking antidepressant medication, currently training or have trained in Tai Chi in the past 12 months, currently exercising on a regular basis, or currently pregnant. For randomization, eligible participants are randomized equally into one of three groups: the Tai Chi group, an exercise group, and a weightless group. For the Tai Chi or intervention group, participants are required to complete 5 hours of Tai Chi a week for a total of 12 weeks. This equates to a total of 60 hours or 3,600 minutes. Within those 12 weeks, the first 6 weeks, participants are required to attend a minimum of 2 hours of class in order to learn the 24 stance simplified Tai Chi Chuan, with the remaining hours to be completed at home through self-practice. In the final 6 weeks, the remaining 5 hours per week are to be completed completely through self-practice. The Tai Chi sessions will involve group practice with instruction given in both verbal and visual form to demonstrate both the movements and the basic theory behind each action. The simplified 24 stance Tai Chi Chuan was chosen for its simplicity to learn and standardization of movements. Furthermore, the international recognition of this Tai Chi style allows for easy access to resources and support for participants should they require it. Participants in the exercise group are required to complete 5 hours of exercise a week for 12 weeks, for a total of 60 hours or 3,600 minutes. Of those 5 hours a week, 2 of the hours must be spent at the UTS Fitness Center, and of those 2 hours, 1 hour must be spent in a scheduled exercise class. For the waitlist or non-active control group, the participants will be idle and will continue their normal lifestyles based on the initial inclusion criteria that they were not exercising on a regular basis. The outcome measures for this study include the state trait anxiety inventory as the primary measure, and secondary measures such as the perceived stress scale 14, heart rate variability, blood pressure, short form 36, and the visual analog scale. The sample size for the study: a total of 42 participants are required for this study, with 14 participants in each group. This sample size is based on the state anxiety results from the pilot study completed in 2011. To account for dropouts or loss to follow-up, the sample size needs to be inflated by 30% based on the pilot data, resulting in 57 participants in total to be recruited, with 19 individuals per group. The study design has several highlights. Firstly, the trial design seeks to test the clinical efficacy of Tai Chi, both as an intervention administered to an individual under guidance, as well as to evaluate if the results can be sustained without the ongoing assistance and supervision of an instructor. If Tai Chi is shown to accomplish this, it will translate clinically to a patient-empowered and economically sustainable method to moderate stress. Secondly, the inclusion of an active control group is to control for the physical or exercise component within Tai Chi. This design ensures that non-exercise components of Tai Chi are also taken into consideration when comparisons are made. This is the conclusion of the presentation. Thank you for your attention.